Do one. All right.
Hi everyone, my name is Sarah and my partner is Danielle, and today we're going to be presenting on our health campaign, which we decided to name Sin Piquete, Making Healthy Choices with Diabetes. So for our problem statement, diabetes has been a major public health issue and continues to affect people worldwide. If diabetes is not managed properly, consistently high blood glucose levels can lead to blindness, kidney failure, heart attacks, stroke, and lower limb amputations. Several environmental and biological factors can lead to diabetes, such as lifestyle, diet, physical activity, and a number of psychological triggers, such as hereditary susceptibility. Also, American adults have a 40% chance of developing type 2 diabetes at some point in their lives. However, Hispanic Latino adults have a 50% chance of developing diabetes and are more likely to develop it at a younger age. So our campaign, the Sin Piquete, aims to encourage those in the Hispanic Latino population living in San Diego with type 2 diabetes mellitus or care for someone with type 2 diabetes mellitus to take charge of their health starting in the kitchen. So participants will learn about diabetes self-management through dietary tips and nutrition education. So our health education objectives, we decided to go with two communication objectives, which are in 6 months from the start of the campaign, 10% more Sin Piquete campaign participants will be able to list at least 3 dietary tips to help them manage their diabetes. And our second objective is in 6 months from the start of the Sin Piquete campaign, participants of the program will also be able to list 3 foods they should avoid and why they should avoid them. So for our health communication theory, we decided to go with the theory of planned behavior and new media theory. Sin Piquete strives to change participants' attitude towards culinary nutrition by showing Hispanic Latinos how to properly cook healthy Hispanic Latino traditional dish in order to manage their diabetes through our live cook-alongs on Instagram, TikTok, and Facebook. Sin Piquete also aims to change participants' perceived social pressure to engage in reducing the average amount of carbs in their home-cooked meals to 60 grams per meal with the cookbook that will be distributed. And Sin Piquete also aims to change Hispanic Latino perceptions of how easy or difficult it is to list at least 3 dietary methods to help them manage their diabetes. So I'll go ahead and pass it along to Danielle, who will talk about the new media theory.
Thank you, Sarah. And so we chose the new media theory because, especially during our current day and age, social media, all the technological advancements were connected more than ever. And so we decided that the Sin Piquete campaign will be promoted through popular applications like TikTok, Instagram, and Facebook. So what we're going to do is we're going to create a Sin Piquete account for all of those social media platforms so that we can promote through all three and reach more people and a wider audience. Live sessions of our nutrition education curriculum and the cooking demos will actually be hosted through Zoom, also Instagram Live, Facebook Live, and TikTok Live, again, to be accessible to a larger audience so that, of course, people can choose their preferred social media platform. And from the comfort of their own homes, our participants will be able to have the opportunity to participate in our cooking demos by following the kitchen if they like and cooking with them while also participating with their instructors and other class participants. Now, with our health communication planning, we actually created quite a few materials, which I will actually show right now. So the first one is our flyer. So we plan to distribute and promote 2 ways. First one is our flyers that we will be handing out at clinics, hospitals, mini markets, and supermarkets. We can hand these out. It has all the information, a basic description of what they can learn and what's included in this class. And then it'll also have our social media accounts through Instagram, Facebook, TikTok, and then of course we would be sending sending out invites through Zoom if they chose Zoom. Here's our first class. And so that's the flyer. And we also have a registration link right here. The second thing that we have are educational handouts. So there's two that we include that go and follow along exactly with our curriculum, which is class 1. And so the first one is our making healthy choices with diabetes. These are some basic survival skills that we have, created for our participants so that they could not only follow along during class, but also keep these for themselves for future reference. The second one is a more detailed instruction manual on how to count carbohydrates. Sometimes there's the huge misconception of, wait, aren't carbs bad for you? Especially for those with diabetes. And so here we kind of break down why carbs are important, why they're the nutrient that matters the most during diabetes, and just kind of basic, how many carbs should I eat? How do I count my carbs? How many should I have per meal? How do I read a nutrition label? And then also kind of rules of thumbs for some of the foods, the most basic foods we have. So if someone wanted to have a sandwich, one slice of bread is 15 grams. And of course, this is something we break down during class. So if we're going to make a sandwich, that's 2 slices of bread, which is 30 grams, and we can have up to 60. So this is a step-by-step how to count carbohydrates. Another material that we created is our class 1. So Sin Piquete is divided into 2 classes. The first one is a presentation, interactive presentation. And this is our PowerPoint where we kind of discuss everything about diabetes in the most basic terms, difference between type 1 and type 2. Our focus is type 2 in our campaign. What happens if diabetes goes uncontrolled, some basic survival skills, and most importantly, the nutrition aspect of our campaign. What are carbohydrates again? A lot of these points are in our handouts as well, so that they can, again, follow along. And if they miss something, it's all in the handouts and that they could study on their own. And so that's just part of our PowerPoint presentation. During our second class for the campaign is the cooking demonstration. So the first class was breaking it all down, and the second class is putting all together, getting them excited to eat at home. Of course, this part is optional, where they can bring their own ingredients. They can buy their ingredients to prepare. We do explain to them which recipes we'll be going over, but our recipe book has about 9 recipes. And so they can go through all of these. It has nutritional content on there, everything that they need to know about their food. And, also these are all Latino, Hispanic dishes that are pretty common. And so we included that for class 2. And then of course we have our pre, post, and follow-up assessment handouts. What we're going to be doing at registration, they will be also completing the assessment, the pre-assessment survey. After class 2, they'll be completing the post-assessment survey and then the follow-up assessment survey, which all contain the same questions. It's for us to compare across all 3 documents how much they've improved against our communication objectives. And so going back to this, so that was our communication planning and all of our campaign materials. We did do a pilot study with a participant from our target audience, which was an individual who is Hispanic Latino or Latina from San Diego. And all in all, she definitely got the entire message. She liked that we talked about diabetes in a simple form and, the importance of carbohydrates. Again, had the misconception of carbohydrates being bad for you. She definitely got the bottom line too, as to, taking control of diabetes rather than letting it happen and not really taking care of their health. She did point out a few things which we're going to go over in the conclusion, but she did recommend that we have more recipes. As you know, when you think recipe book, you think of a thick book of recipes. And so something that, that would be considered for in the campaign for improvement, more recipes. We only had main meals like breakfast, lunch, and dinner on there. She did recommend to have snacks. And then she also felt, although the information was very helpful on the handouts, they were kind of wordy. So maybe we could reword them so that they have a better reading level for our participants. But overall, she enjoyed the campaign, thought it was very important. In conclusion, some things that our participant did mention was that that there are some socioeconomic factors that need to be considered because food access and kitchen access is not always there for our participants. We did consider this. That's why we made the cooking demonstration optional. But another factor is that people might not have a phone, or maybe they don't have access to social media platforms. However, there are resources out there that people can utilize to get access to smartphones. So what we would do in the future was provide links and to those resources and lead them in the right direction to get that access to social media and a smartphone. Another major component that we did not consider and were not aware of until this pilot study was that there weren't any seafood recipes in a recipe book. And in Hispanic Latino traditional dishes, there's lots of seafood in there. The reason why is because, one of us doesn't actually like seafood. So that's something that should not have influenced our recipe book. Again, if we were to add more recipes to the book, we would include seafood. And lastly, what we really loved about our campaign was that it was designed, as you can see from this presentation and all the material, to be warm, very interactive, and just to build rapport within the group and the instructors so that a family environment is created. Because if you think about it, if there's relationship building, are more likely to come to the next class. And also too, as a group, kind of like working out, it might be hard to do on your own and manage on your own. But if you have a support system, much like what we would build with this class, they could all, work together, encourage each other to lead healthier lives. And so that concludes the Sin Piquete campaign. We hope you enjoy. Other than that, have a great night.